Good afternoon, Dragons. My name is Lesley Turner, and I'm a breast cancer patient and a member of the Palliative and Supportive Care Clinical Studies Group. And my colleague, Theresa, is a health service researcher at the Mount Vernon Cancer Centre. And we're here today to bid for £250,000 for research into treatment options for women suffering from hot flushes. The facts are that there are an estimated 550,000 women living in the UK today who've been diagnosed with breast cancer. And up to 70%, that's 70% of these women experience hot flushes after cancer treatment. That's an awful lot of hot flushes. And they're a serious problem that impacts significantly on daily life, sleep quality, employment, relationships. The list is endless. And what's even more shocking is that around 50% of women stop taking their endocrine treatment before 5 years, and that's due to side effects such as hot flushes. And this leads to a 20% excess in breast cancer mortality. Shocking figures. Now, this isn't a picture from the Tate or Tracy Ehrman's bed, but it's the bed of a breast cancer patient following a typical night when she would suffer from around 15 to 20 hot flushes. So you can imagine how distressing this is for her and for her family. It's not pleasant, is it? So patient advocate members of the NCRI Clinical Studies Group identified that there was very little research done into the management of symptoms after breast cancer, and that this constituted a gap in the current portfolio. So we set up a working party on symptom management, and the first thing we did was to send out a hot flushes questionnaire to patients and to healthcare professionals. And 94% of the professionals agreed, or strongly agreed, that the management of hot flushes is an unmet need. And scarily, 40% of women said that nobody had ever asked them that question. So healthcare professionals currently offer hormone replacement therapy, drugs like MEG-ACE, SSRIs, but these drugs have significant side effects, and most people don't want to take any more drugs. Acupuncture appears to be one of the more popular and effective non-drug treatments, but there is a real urgent need for research in this particular area.
So I'm going to tell you now about the proposal that we have. We would like to run a feasibility study for a two-centre randomised controlled trial comparing group acupuncture with standard care versus standard care alone. And so the patients would be offered 6 sessions of group acupuncture, which they need to complete in 8 weeks. At the centre where I work, when we've finished our acupuncture, we get a lot of requests for top-up acupuncture sessions or how can I self-acupuncture. So we're interested to offer the patient a choice of these and see if there's any patient preference and see how that works. And then we would also do some qualitative interviews with both the patients, the acupuncturist and the health professionals. Eligible patients would have finished their curative treatment, radiotherapy, chemotherapy, surgery, and they will have been on the hormonal therapy for at least 3 months. There is a questionnaire that measures adherence, and they will have scored less than 80% on that, and they will be experiencing some symptoms as a consequence of that hormonal therapy, not necessarily just hot flushes, because again, from the interviews we've had with the patients, it's not only hot flushes, there's arthralgia, there's a whole range of other symptoms. The outcome measures that we would use, we want to know the recruitment rate. So are women actually willing to be randomised into a trial with a no treatment control arm? What's the uptake? Once they're randomised in the study, do they manage to complete all 6 sessions? Is that too many? Is 8 weeks a reasonable time to allow for holidays and other things? And do they carry on filling in the outcome measures for long enough for us to assess at least the short-term benefits up to about a year? We're also interested to know which, if either of the 2 additional treatments the patients prefer, and that we will find out from the qualitative interviews. And we need to calculate some effect sizes so that if the study's if the feasibility study is successful and we proceed to a bigger study, we can work out the patient numbers. On the back of an envelope, I have estimated that if the study was successful, it costs about £1,000 to run a group session for 5 patients for 6 weeks. So that's about £200 or £300 per patient. And there's one published paper that estimates that the cost of non-adherence is £34,000 for a patient, going from poor adherence to good adherence. Okay, so we are seeking £250,000 for 24 months to cover the researcher's salary, the statistical analysis and dissemination, open access, and all the usual things that you need for a good research infrastructure. Thank you.
Thank you very much, and we'll go straight into the questions from the Dragons. John?
I thought it was a really good talk. I think it's very exciting. I think the potential benefits I can see for people outside this group, maybe women who don't have hormonal therapy, and maybe some men. Can I ask, are there any key subgroups of patients at different types of hormonal therapy that you consider, or age or menopausal status? It's not my area of strength that you need to think about. Otherwise, it was a good presentation.
My understanding is that hot flushes are particularly distressing for younger women, and also for old women who have gone through a menopause, think they finished with that sort of symptoms, and then they're quite distressed when they come back again. So those are the two groups that I think find it most distressing, but I don't know whether that's not necessarily to say that acupuncture might be more effective in either of those subgroups. So I don't know of any research around efficacy by subgroup. I just know about distress by subgroup is
Do we know if any interventions are better at stopping people developing hot flushes, i.e. you should have acupuncture before you start your hormonal therapy, rather than necessarily as an intervention once a woman's got established in what may be a vicious cycle of hot flushes, poor sleeping, low mood and things?
Yeah, as far as I'm aware, there isn't much out there. There's very, very little research, and that's exactly the sort of research that we should be funding.
So, as I've got the microphone, and no one's going to block me,
Yeah,
are there any opportunities for translational work you could do at the same time, maybe looking at circadian rhythm and hormonal status that might be affected in some way by acupuncture that we don't know about?
Yeah, if you'd like to give us the £1 million, then we'll very happily look into those areas. No, but this is extra.
We can always
but
build on.
we can always build on it.
We've got several months.
Absolutely, and it would be interesting to find out the
more ideas now.
very interesting to find out the mechanisms of hot flushes and why, how that works. So that could be a whole new area where we could do research. Yeah.
I'm going to ask a very practical question because I'm thinking about the acceptability of it to patients. So I'm trying to imagine how group acupuncture works.
You're going to watch them? Oh,
So
I imagine them in a circle.
Not passing the needle along.
So in the centre where I work, we currently use ear acupuncture, and the patients sit in a small circle. We have 2 adjacent rooms, and the needles are put in one room, and then the patient walks across the corridor and sits down. So they have about a couple of minutes with the therapist on their own, and then they sit in a group setting in the adjacent room. There are issues around. You couldn't have soft chairs like these because if you lose the needle, we have to. So there's all sorts of other issues you have to consider. But
where are you putting the needles?
Sorry?
Where are you putting the needles?
In their ears.
Not in the...
No, but if the needle falls out and it falls into a soft chair or a cushion, and you have to count the needles in and count them out into your yellow safety box.
Matt?
Okay, so I'm going to be the cynical clinician here. Okay, so seems to me there are 3 possibilities about acupuncture in this, and actually in any setting. One is that it doesn't work at all. One is that it does work, but its effect is purely a placebo effect, and that's a useful effect, but it's purely a placebo effect. And third is that it does work because of where you put the needles and because of the science, if you like, behind acupuncture. Now, it seems to me that this question won't be, that the question of whether it's working at all is answered by this trial, but whether it's working because of it being acupuncture in the right place and so on is
It's
not
not been.
addressed at all by this trial. So I'm going to say that well, actually I'm not going to tell you I'll give you the money, I'm not allowed to say that yet, but I'd be quite interested in this study, but I'm sort of aching for a 3-arm study with a sham acupuncture arm in there, because I don't feel comfortable at all about the idea that we do a trial which comes up with a result that says acupuncture works and therefore the NHS will have to fund it for eternity, when clearly we won't have proven that. All we'll have proven is that people who had acupuncture felt better, and that's not the same thing.
I think it's a little bit more than feeling better, because if we keep the patients on their endocrine treatment, there's a huge
that's
saving.
Fine.
Yeah.
But that could be a
Yeah,
purely
yeah.
placebo treatment.
Again,
But
if
I
you
want to know which it is before we then start funding it for
The other thing
eternity.
is, no acupuncturist would ever say that their treatment is only the needles. It's the whole holistic approach, the care, the attention, and there's probably going to be a group effect in this as well.
Which is
So-
the problem that Matt's
Yes.
identifying, is
Yes.
which bit of that is working.
But
Okay,
But-
we have to stop there. Sorry, Joe, we have to move on.
I was
Okay.
just going to point out that Matt said he was going to Peter Jones because Peter Jones is not.
Okay, thank you very much.